Biden administration has now declared monkeypox a national health emergency. That's a rare designation aimed at freeing up emergency funds, removing some of the red tape to help everyone respond.
Joining us live now, UCSF's Dr. Peter Chin Hong. So thanks for joining with us. There's been a lot of criticism on the federal response to monkeypox so far. So can you explain how this declaration will help, and is it coming too late?
Well, I think, Ryan, the main criticism that we can't turn back on is speed. I think this declaration should have been made a long time ago. And the reason why is because we need everyone coming together to share data. I think everyone thinks this is actually the tip of the iceberg. We actually have more cases because jurisdictions and states don't have an obligation to report it to the CDC until it's a national emergency. Number two, I think it will help with the 3 M's. So money. First of all, medicines. We have TPOXX. I think it will be great if we have it under emergency use authorization instead of having to fill out all that paperwork to get it a patient treated. And the third M is, of course, metadata, because we need these communities to talk to the CDC so we know what's going on. You know, everyone's focused on vaccines, but, you know, we're limited by the actual numbers coming in. But even that, I think this will allow us to think rationally about whether or not we can get as many doses as possible into the arms, even if we have to deliver it in a different way.
So tell us about what you've seen so far from people who've had the virus. We're starting to see some more images, people sharing pictures on social media, which I think is helpful because you know sort of what to look out for. And one of the things I hear people complain about is how painful this is. So describe what this is like for people.
Yes. So, you know, again, although it doesn't kill as many people, people said it feels like death sometimes when it's so extensive and it's so painful. It's like being in like one of my patients described it as putting his hand in a tub of hot water and not being able to take it out. So people can have bleeding in the rectal area, bleeding in while urination, and pain, sores all over your mouth so you can't eat or drink, disease near your eyes. If it gets in the eyes, it can cause you some vision loss. So it's not a walk in the park. There's a lot of suffering with this.
And we know the virus is spread from skin to skin contact. So what's the likelihood of getting exposed from everyday activities like touching surfaces at the gym? And we have that big event coming up, the Outside Lands Festival coming up, where people are going to get very close together. Should those people be concerned?
They shouldn't be concerned. I would think of that as low risk in general. I'm more concerned about activities that happen before and after Outside Lands, when people get together in private, intimate settings. So you're right, Ryan. The biggest font size for risk is really skin to skin from an open lesion, because what happens in that context is that you make these little microabrasions in the uninfected skin, and the virus can get in that way. Other ways are, of course, you know, bed sheets of somebody with active disease in a household, not in the general population, not in Bed Bath and Beyond, but in a household with an active case. And then in terms of respiratory spread, this is really an animal virus. So you really need to be up close and personal in general for 3 to 6 hours without a lesion visible to get it from respiratory spread. That's how we believe at this point.
All right. Thank you very much, Dr. Peter Chin Hong, for joining us. Always some good information.